Hello everyone, good day and welcome to Alena Media TV. We are broadcasting from Toronto, Canada. I am Elsa Abraham. In today's headlines, we have coronavirus updates. Now let's go for our news in details. Coronavirus world cases are now 23,637,289. Deaths are now rising to 813,415, and recovered cases are now 16,132,744. Now, when we come down to Africa, COVID-19 cases are now 874,036, and we have deaths of 18,498. with recoveries of 524,557. There are now more than over 870,000 confirmed cases of coronavirus across the continent, with a number of African countries imposing a range of prominent and containment measures against the spread of the pandemic. According to the latest data by African Center for Disease Control on COVID-19 in Africa, the breakdown remains fluid as countries confirm cases as and when. As of May 13, 2020, every African country had recorded an infection, the last being Lesotho. Confirmed cases are now 874,036. Active cases are now 330,981. with recoveries of 527,557. The total number of deaths are now 18,498. Eritrea's total cases are now 306, recovery of 274, and active cases are now 32. Djibouti cases are now 5,382, with 60 deaths, and recovered cases are now 5,254. Sudan cases rises to 12,836, with deaths of 815. Recoveries are now 6,497, with active cases of 5,524. Ethiopia also has 40,671, with deaths rising up to 678. Recoveries are now 14,995, with active cases of 24,998. Moving on to our next story for the day. The WHO Director General opening remarks at the media briefing today, 24th August, on COVID-19. Last week, I sent a letter to all member states requesting to join the vaccine arm of the ACT Accelerator. I am pleased to announce that as of today, 172 countries are now engaging with the COVAX Global Vaccines Facility, which has both the largest and most diverse COVID-19 vaccine portfolio in the world. At present, there are 9 vaccines that are part of this dynamic portfolio, which are constantly being reviewed and optimized to ensure access to the best possible range of products. Even now, discussions are ongoing with 4 more producers, and a further 9 vaccines are currently under evaluation for the longer term. The facility is the critical mechanism for joint procurement and pooling risk across multiple vaccines so that whatever vaccine is proven to be safe and effective, all countries within the facility will be able to access them. Most importantly, it is the mechanism to enable a globally coordinated rollout. This is in the interest of all countries, even those that have invested with individual manufacturers independently. We are working with vaccine manufacturers to provide all countries that join the effort timely and equitably access to all vaccines licensed and approved. This doesn't just pool risks, it also means that prices will be kept as low as possible. New research outlines that global competition for vaccine doses could lead to prices spiking exponentially in comparison to a collaborative effort such as the COVAX facility. It will also lead to a prolonged pandemic, as only a small number of countries will get most of the supply. Vaccine nationalism only helps the virus. The world has so far invested $12 trillion in keeping economies moving. Investing in the COVAX facility is the fastest way to end this pandemic and ensure a suitable economic recovery. Through the allocation framework, COVAX will ensure that low, middle, and high-income countries all receive the vaccine in a timely way as soon as there is a supply of a safe and effective vaccine. The success of the COVAX facility hinges not only on countries signing up to it, but also filling key funding gaps for both the research and development work and support lower-income economies within the facility. Our only way out of this pandemic is together. Initially, when there will be limited supply, it's important to provide the vaccine to those at highest risk around the world. This includes health workers, as they are on the front lines in this pandemic and critical to saving lives and stabilizing the overall health system. It also includes people over 65 years old and those with certain diseases that put them at higher risk of dying from COVID-19. As supply increases, the next stage of the vaccine rollout will be expanded based on an assessment of each country's vulnerability to the virus. A number of vaccines are now in the final stage of clinical trials, and we all hope we will have multiple success candidates that are both safe and effective. In order to be able to secure enough doses to roll out the vaccines, the next step for the partnership is for African countries to make binding commitments in support of the COVAX facility. While we are grateful for the funds already committed towards the COVAX facility, more are urgently needed to continue to move the portfolio forward. The goal of the mechanism is to deliver at least 2 billion doses of safe, effective vaccines by the end of 2021. As governments invest trillions into economic stimulus, the COVAX facility offers a huge return on investment. There is light at the end of the tunnel, and as I said last week, together we can do it. While investing collectively in research and development on vaccines, we need to also use the tools at hand that we have now to surpass this virus. As governments hone their track and trace systems to test, isolate, and care for patients and trace and quarantine their contacts, everyone can play their part. If we all physically distance, clean our hands regularly, wear masks, and keep informed, we can collectively break the chains of transmission. Communicating challenges and solutions has and will continue to be to the ending of the pandemic. More than 4 million people have enrolled in our training courses through the openwho.org online training platform. WHO is partnering with the World Federation of Science Journalists to accelerate communication and intricate science as it evolves. Through our regional offices, the World Health Organization has organized webinars in multiple languages for journalists to counter misinformation, and a massive open online course for journalists covering the pandemic was created through a partnership between the World Health Organization and UNESCO and the 9th Center for Journalism at the University of Texas, Austin. This online training was delivered in English, French, Portuguese, and Spanish, and will soon be available in Arabic, Chinese, Russian, and Hindu. We are learning new things about this virus every day, and journalists are critical to helping us communicate that information to the public in a way that saves lives. We will continue to promote science solutions and solidarity because we believe to our core that we do it best when we do it together. Together, we can all fight this pandemic. This is where we end today's episode. Please like, share, comment, let us know your thoughts on this particular episode. Don't forget to subscribe. Thanks for watching.